Okay, now we're going to talk about internal ionizing radiation imaging. With internal ionizing radiation, the goal is to place the ionizing radiation source inside the body rather than outside the body, and then use detectors to detect the ionizing radiation coming out from the body. This is sometimes referred to as nuclear medicine. The most common imaging techniques are what we call PET scans or SPECT scans. The idea is you take a radioactive isotope that will bind to specific proteins or chemicals in your body. We then inject that into the blood, and we allow that to travel through the body for a certain amount of time, which can range from a few hours to a day or so. And then we place the person in a detector that looks to see where that radiation has congregated, and we construct an image based on that. So some of you may be a little freaked out about the idea of injecting radiation into the body. It is on par in terms of its risks with external ionizing radiation. Again, something you wouldn't want to do all of the time, but it is not any more dangerous than getting an X-ray for a bone break or anything along those lines. So the two primary techniques, like I said, were the PET or the SPECT. The biggest difference is what exactly they are detecting being emitted from the body. In SPECT, it's called the single photon emission computed tomography. Basically, they are looking at a single photon that is being ejected or emitted from the radiation that was injected in the body. And then it creates a heat map of where this ionizing radiation is being sourced from. Right. So in the heat map, the closer to the orange and the red we are, the greater the concentration, and the further we are into the blue, the less the concentration. And so as you can see, we can actually construct an image of the brain based on the distribution of the emitted radiation. Positron emission tomography actually uses two particles instead of one, which can dramatically increase the resolution. Basically, if we look over here at SPECT and PET, the PET scan uses a detector that is 360 degrees around the brain, and when radiation is emitted, it actually ejects at 180 degrees, two different particles, and the detector is able to determine when an emitted particle strikes on two opposite ends at the exact same time. It can triangulate the emitted source to a much smaller area, thus increasing resolution, whereas the SPECT is a rotating detector that is picking up only a single particle that's emitted at a time. So as I said, with external ionizing radiation, there's not a lot of research applications for it. The PET scans, on the other hand, is where we begin to see a lot of research being applied. Even though we are using ionizing radiation, the potential scientific benefit is quite huge. Keep in mind that the pictures that we see are not really all that great in terms of the resolution structurally of the brain. The advantage to the PET scan is you can create specific particles that bind to specific proteins or chemicals, and therefore you can image only certain things within the brain. For example, neurotransmitters. You can create specific binders for things like dopamine and serotonin, or GABA, or acetylcholine. And this will actually create an image of the concentration of dopamine and serotonin or GABA or acetylcholine or almost any other neurotransmitter in the brain, so you can see where it's at. You can also detect level differences between them. Right? So people who have high or low levels of dopamine can actually be detected based on the concentration of the emitted particles within those regions. So it really lets you do things that no other technology can. For example, there's the Pittsburgh compound B that binds to amyloid plaques, which are a known correlate with Alzheimer's disease. And you can actually detect the presence of these plaques even before people become symptomatic. So this is an Alzheimer's patient, and this is a control, and this Pittsburgh compound B binds to these plaques that form as a part of the disease, and you actually see them forming in the brain, and this can be used to do differential diagnosis very early on. In fact, when we look at many forms of dementia, they're often clinically very difficult to differentiate. They often look very similar to each other, whether you're dealing with Alzheimer's, PICS, multiple infarct dementia, Huntington's. There are some clinical differences, but can be difficult to detect. However, using certain PET scans, you can see right away major differences in these different types of dementia, allowing for dramatically improved diagnosis as well as research applications. For example, many people have heard this idea that we only use 10% of our brain, and if we could somehow use more of our brain, we would be smarter and quicker and have magical abilities. Well, we can actually bind a PET emitter particle to, say, glucose. And we can actually look at the metabolic rate of the brain by using something called fluido-oxyglucose. And this will bind to glucose in the brain and shows actually the metabolism. So this actually gives us a scan for how much of the brain is active at any given moment. So over here on the left, we can see somebody has dramatically increased metabolic rates in the brain, whereas over here on the right, it's much more limited. And contrary to the mythology, what we find is that when we see people who are higher IQ scores or other correlates actually have a lower metabolism within the brain. They're using less of their brain to accomplish the same tasks. Many of you have probably experienced this when you're learning something new. You might find that your brain is just on overdrive. You can almost feel it being used. It's exhausting. Whereas once you have mastered something, it takes almost no brain energy at all. Right? So these are just a couple of examples of the wide range of applications that internal ionizing radiation allow us both in medicine and in research.